What if the reason so many women struggle to reach climax has nothing to do with their bodies being complicated or difficult, and everything to do with a simple gap in knowledge that most people never think to question? I'm talking about understanding a part of female anatomy that holds more concentrated nerve endings than almost anywhere else in the human body, yet somehow remains one of the most misunderstood and overlooked aspects of intimate health. Just a few minutes of learning what this structure truly is, where it genuinely extends, and how it actually responds could change the way you experience pleasure for the rest of your life. Welcome. Please stay with me for the next few minutes, because in this video, I am going to reveal something that even many doctors don't fully explain to their patients, something that changes the entire conversation about female satisfaction and pleasure. What you'll be learning today is not just anatomy, it's a complete reframing of how a woman's body is designed to experience deep, natural pleasure. By the end of this video, you will understand exactly why so many women have struggled for so long and what you can do starting tonight to create a completely different experience. I'm Dr. Lily Stones, a gynecologist and intimate health psychologist with over 30 years of experience helping women reclaim their natural capacity for pleasure and satisfaction. Today, I want you to imagine understanding your body in a way that makes intimacy feel effortless, natural, and deeply fulfilling. No guessing, no frustration, no feeling like something is wrong with you, just clarity about how your body actually works and what it truly needs to respond. Before we dive in, do me a favor, hit like, leave a comment telling me where you're watching from, and make sure to subscribe with the notification bell on. That way, you won't miss any of these practical tips to reclaim your strength and confidence. By the end of this video, you will know the real anatomy behind female pleasure. Understand why most advice misses the most important part. Discover exactly what kind of touch and attention actually creates the sensations you've been hoping for. And if you really want to make a lasting change, you will love the simple practice I'll share with you at the end. But first, you need to understand why so many women go years, even decades, without experiencing the full depth of pleasure their bodies are capable of. Because once you know what's been missing from the conversation, you'll realize this was never about your body being broken or difficult. It was about incomplete information being passed down through generations, leaving women to figure things out on their own. The missing information now, let's think about how most people learn about intimacy and pleasure. For many, the education comes from sources never designed to teach accurate anatomy or realistic expectations. The truth is, most people learn from media, from partners who also lack proper education, or from brief, embarrassed conversations that skim over the most important details. The result is that women grow up believing their bodies are somehow more complex or harder to understand than they actually are, when the reality is far simpler and far more beautiful. Here's what really happens when a woman's body is ready to experience pleasure. 3 systems must communicate smoothly and clearly. Your brain sends signals of desire and anticipation. Your blood must flow freely and deeply into the tissues that create sensation, and your muscles need to respond with natural rhythm and strength. But here is where the confusion begins. Most people think the primary source of female pleasure is internal, deep within the vaginal canal. While the vagina plays an important role, it is not where the highest concentration of sensation actually lies. This is why so many women feel disconnected during intimacy, why arousal seems elusive, and why reaching climax can feel like an impossible goal. It's not that your body is failing you. It's that the focus has been placed on areas with far fewer nerve endings, while the true center of pleasure has been overlooked or misunderstood. Unveiling the true center of pleasure, and here is where it becomes truly fascinating. What I'm about to share is based on modern research that only became widely known in the last couple of decades. Even though the anatomy has existed all along, the structure I'm talking about is your clitoris. And before you think you already know what I'm about to say, let me stop you right there. Because what you think you know about the clitoris is likely only a fraction of the truth. Most people believe the clitoris is just a small button at the top of the vulva, a tiny spot that needs a little attention before moving on. But that understanding is dangerously incomplete. The visible part, the part most people think is the entire clitoris, is actually just the tip of a much larger, much more intricate organ. Let this information sink in for a moment and replay this part if you don't understand it fully yet. Now let's talk about what the clitoris actually is in its complete form, because this is the knowledge that changes everything. The clitoris is not a small button. It is a complex structure that extends deep into your pelvis, wrapping around the vaginal opening with two long branches called crura, and sitting beneath the surface with bulbs of tissue that swell and become engorged during arousal. In total, the clitoris contains over 10,000 nerve endings, which is more than double the nerve endings found in the head of the penis. Now, listen closely so I can explain why this matters so profoundly for your experience of pleasure and satisfaction. Just beneath the surface of your skin lies this vast network of erectile tissue, nerves, and blood vessels that directly influence arousal, lubrication, and orgasm. When you understand that the clitoris is not just external, but extends internally, wrapping around the vaginal canal, you begin to see why certain types of touch and certain angles of stimulation feel so much more intense than others. You are not just touching a single spot, you are engaging an entire system. What happens beneath the surface during arousal is remarkable. Blood flows into the clitoral tissue, causing it to swell and become firm. Just like an erection, the nerve endings become more sensitive, more responsive, and more ready to send signals of pleasure to your brain. This engorgement is not optional. It is essential. Without it, the sensations you experience will feel muted, distant, or even uncomfortable. This is why rushing through arousal, skipping the buildup, or focusing only on penetration often leads to frustration and disappointment. Working with your anatomy now, how do you begin to work with this knowledge? Don't worry. Understanding your clitoris is not about complicated techniques or memorizing complex instructions. It is about recognizing that this structure needs time, attention, and the right kind of stimulation to fully awaken. Just like any other part of your body, the clitoris responds best when it is given gentle, patient, and varied touch. Think of it like warming up before exercise. You wouldn't sprint without stretching first, and you cannot expect your body to reach full arousal without giving it the time it needs to respond. Right beneath the small visible portion, at the top of your vulva lies this extensive network of tissue that influences every sensation you feel during intimacy. You will know you've found the right approach because the sensations will build naturally, warmth will spread through your pelvic region, and your body will begin to respond with lubrication, muscle tension, and a growing sense of anticipation. Don't stop here. At first, it might feel unfamiliar to pay this much attention to external stimulation, especially if you've been taught that penetration is the main event. But as you begin to prioritize clitoral stimulation, that initial awkwardness melts away, replaced by a growing sense of clarity, pleasure, and confidence in your own body. Now, make sure you understand this part of the video and play back if you need to. It's time to dive into how arousal actually works, because understanding the timeline of your body's response is just as important as knowing the anatomy. The arousal timeline and the right touch, this is where so many people, both women and their partners, get it wrong. The assumption is that arousal happens quickly, that bodies are ready for penetration within a few minutes, and that if a woman isn't responding right away, something must be wrong. But that is not how female arousal works at all. I always say that the first step is recognizing the timeline. Unlike male arousal, which typically reaches full readiness within 2 to 5 minutes, female arousal takes much longer. On average, a woman's body needs anywhere from 15 to 45 minutes to become fully aroused. That means her blood flow needs time to reach the clitoral tissue and the vaginal walls. Her body needs time to produce natural lubrication. And her vaginal canal needs time to lengthen and expand to accommodate penetration comfortably. Without this time, intimacy can feel uncomfortable, even painful, and reaching orgasm becomes nearly impossible. The next step is understanding what full arousal actually looks like. When a woman is fully aroused, her clitoris has swollen significantly, sometimes even retracting slightly under its protective hood because of how engorged it has become. Her labia, the inner and outer lips, will have changed color, often becoming darker or more flushed with increased blood flow. Her vagina will have produced lubrication, and the entire pelvic region will feel warm, sensitive, and alive. These are not optional signs. They are the body's way of saying it is ready for more intense stimulation. Now, let's talk about the kind of touch that actually works. This part is key for creating pleasure that builds and intensifies rather than fading away. The clitoris is incredibly sensitive, which means that heavy, direct pressure right from the start can feel overwhelming or even uncomfortable. Think of it as needing a gentle introduction before deeper intensity. Start gentle and indirect. Begin with light, indirect touch around the clitoral area, not directly on the most sensitive part. Use slow, circular motions, varying the pressure and speed based on how the body responds. Engage the internal structure. Remember, the clitoris extends internally. Stimulation that involves gentle pressure on the front wall of the vagina, about 1 to 2 inches inside, can engage those deeper nerve endings. This is what people often refer to as the area sometimes called the front wall zone, but what you are really doing is stimulating the internal legs and bulbs of the clitoris through the vaginal wall. Some women find this incredibly pleasurable, while others prefer purely external stimulation. Both responses are completely normal. Maintain consistency. This is something that cannot be overstated. When arousal is building, when breathing deepens and muscles begin to tense, the worst thing you can do is suddenly change what you are doing. Keep the same rhythm, the same pressure, the same motion. Let the sensations build without interruption. This consistency is what allows the body to climb toward climax rather than constantly resetting back to the beginning. That is the complete approach. Start with external clitoral stimulation. Take your time allowing blood flow and sensitivity to build. Pay attention to what creates the strongest response, and maintain consistency as arousal intensifies. Simple, natural, and remarkably effective. But stay with me, because there is more you need to know to truly transform your intimate experience. Communication and lasting change. Consistency is absolutely essential, but so is communication. Let me share exactly how to approach this with openness and curiosity. I recommend thinking of intimacy as a conversation between your body and your partner's touch, or between your own touch and your body's response if you are exploring on your own. The key is to create an environment where feedback is not just welcomed, it is encouraged. Many women have been taught to stay quiet during intimacy, to not ask for what they want, or to assume their partner should just know what feels good. But that expectation sets everyone up for frustration. You can practice giving gentle guidance during intimacy. If something feels good, say so. If you want more pressure, less pressure, a different angle, or a slower rhythm, communicate that clearly. This is not criticism. It is collaboration. And when you approach it with warmth and appreciation, it becomes part of the pleasure rather than a distraction from it. The goal is to make feedback feel natural, like adjusting the temperature in a room until it is just right. Now, hear me out. I want to be completely honest with you about what to expect when you begin prioritizing clitoral stimulation and proper arousal time. Within the first few attempts, many women describe feeling a significant difference in how their bodies respond. Sensations that once felt distant or faint become clearer and more intense. Within the first couple of weeks of consistently applying this knowledge, you may notice that reaching orgasm becomes easier, more predictable, and more satisfying. By the time you have practiced this approach for a month or so, most women report a complete shift in their intimate experiences. Pleasure flows more easily, confidence grows, and the frustration that used to accompany intimacy is replaced by anticipation and genuine enjoyment. You begin to trust your body again, to know it can respond with vitality, sensitivity, and deep satisfaction. But here is something important to understand. Every woman's body responds in its own time. If you have gone years without prioritizing clitoral stimulation, your results may take a little longer to build. If this approach is new to you, be patient with yourself. What truly matters is consistency and a willingness to unlearn old habits that were never serving you well in the first place. Deepening the experience now, once this becomes more natural, you can build on it with a few additional practices to deepen your experience. Use a high-quality lubricant. Even if you produce natural lubrication, extra moisture reduces friction, makes touch feel smoother and more pleasurable, and allows for longer sessions without any discomfort. Water-based or silicone-based lubricants work beautifully, and there is absolutely no shame in using them. Combine with pelvic floor awareness. After arousal has built, try gently contracting and releasing your pelvic floor muscles, the muscles you would use to stop urination midstream. Doing this rhythmically can intensify sensations and help you become more aware of your body's internal responses. Stay well hydrated. Arousal depends on healthy blood flow, and hydration keeps your circulation moving smoothly. Proper hydration supports natural lubrication, tissue health, and overall vitality. Create a relaxing environment. Warmth, soft lighting, and a sense of privacy all help your nervous system relax, which is essential for arousal. Stress and tension block pleasure. Anything you can do to feel safe, comfortable, and unhurried will make a significant difference. Now, before you begin applying what you've learned, I need to share some important notes. I recommend you watch this part 2 times. Never force yourself into intimacy if you are experiencing pain, discomfort, or any kind of infection. If something feels wrong, listen to your body and consult your doctor before continuing. Pleasure should never come with pain. If you have been diagnosed with any gynecological condition, pelvic floor dysfunction, or hormonal imbalance, check with your healthcare provider to make sure this approach is right for your specific situation. Remember that this knowledge is meant to support your wellness and satisfaction, not replace medical care. If you have ongoing health concerns such as chronic pain or difficulty with arousal, work with a specialist who can provide personalized guidance. Your 30-day challenge for the best results. Combine this focus on clitoral stimulation with other habits that support circulation, relaxation, and overall vitality. Movement, hydration, stress management, and open communication all work together to create a complete picture of intimate health. In a previous video, I shared how gentle movement and mindful breathing can awaken your body from the inside. When you combine that inner awareness with this external focus, you create a natural flow of energy, sensation, and pleasure. Add simple movement to your day, a short walk, light stretching, or a few slow hip circles. Just 20 minutes helps your blood move freely and keeps your tissues alive and responsive. And remember, stress is one of the quietest blockers of pleasure. Take a few moments each day to breathe deeply, soften your muscles, and let your body know it is safe to relax and feel again. When calm and awareness come together, intimacy becomes more than a physical act. It becomes a gentle reconnection with your own body and your own capacity for pleasure. And now, what you've all been waiting for. I have a simple challenge for you. Starting tonight, commit to prioritizing clitoral stimulation during intimacy for the next 30 days. That's it. Just a shift in focus, a commitment to giving your body the time and attention it truly needs. In the first week, simply practice identifying what feels good. Don't rush or expect immediate perfection. Just build awareness. In week 2, you keep the same approach and begin to notice the shifts. Are sensations stronger? Is your body responding with more natural lubrication and warmth? In the 3rd week, this focus should feel natural, like a quiet ritual you look forward to. Stay consistent, even if the progress feels subtle. Then, in week 4, it's time to reflect. Most women describe this stage as a true awakening, a sense of pleasure, satisfaction, and confidence they haven't felt in years. At this point, this approach becomes more than a technique. It becomes part of how you experience intimacy, a way to honor your body and its natural design. And remember, your body is not complicated. It is just misunderstood. Your clitoris holds more nerve endings dedicated to pleasure than almost any other part of the human body, and it is designed to respond beautifully when given the right kind of attention. It takes time, patience, and knowledge, But it does not require anything complicated or unnatural, only clarity and care. So tonight before bed, take a few quiet minutes to simply explore. Locate your clitoris, understand its full structure, and begin to notice what feels good. Then tomorrow, and the day after, and the day after that, continue to prioritize this knowledge. Make it as natural as any other part of caring for your body. If you want to go deeper into everything we talked about today, I've created a beginner's guide that walks you step by step through reconnecting with your body after 60. It's called The Gentle Guide on Reconnecting with Masturbation as a Woman Over 60, and it explains how pleasure, confidence, and health all work together. Inside you'll find simple techniques, mindset shifts, and rituals to help you rediscover what your body is still capable of feeling gently, naturally, and without pressure. You can buy it in the store on my YouTube channel. Your body still remembers how to feel alive. Sometimes it just needs the right information to fully awaken what has always been there. Now, do not close this video yet. If this video has helped you, I would love you to do 3 simple things in return. First, give the video a like so more women can find this natural, empowering knowledge. Then, subscribe and tap the bell to keep learning gentle ways to support your intimate health. And lastly, share your experience below. Have you struggled with reaching climax before, or are you starting this journey today? Come back in a month and tell me what changed. Your story might give another woman the courage to begin.